You are. So here we go. We'll get started. So welcome to an Alliance member benefit demo. Our friends at Cinematic Health have put together an amazing health aid education series program. I don't want to take up any of their time, but if you just like some couple of housekeeping notes, which you guys are more than familiar with. If you have a question, you have a comment, put it in the chat. Chad and his team have been given our email addresses. So if you want to follow up with them or they want to follow up with you, we can do that after the session. But let's take it away. Chad, do you want to tell us a little about yourself, about your company?
Yeah, absolutely. So thank you, Leslie, and it's great to be here with everyone and a really nice turnout, which obviously shows there's a real need for training and workforce development in the state. And honestly, we all know that, right? I mean, it's everywhere. There's a real need. And but we're very happy to be here. I am Chad Shadler, the Chief Revenue Officer for Cinematic Health. And then we also have, I'll let Jasmine and Melissa introduce themselves from my team.
Wonderful. Well, thank you everyone for joining. I'm Jasmine. I'm the Client Success Manager here at Cinematic Health. I will be the person that you will work with pretty closely throughout the process if you decide to work with us.
Thanks, Jasmine. My name is Melissa. I'm the sales representative here at Cinematic Health, and so I'll be the one showcasing you the program, and then I pass you over to Jasmine. So happy to help.
Great. Well, I'm going to share my screen here and let me get this PowerPoint up and running. Not that way. That's not helping. I've got too many windows open. I'm sorry. Somewhere it's good. There we go. So, so we are Cinematic Health, as we were saying, and we are a company that was founded in 2018. So we were founded pre-pandemic, and we initially came to market focused on the CNA population in long-term care. You know, our founder, or one of our founders, was an administrator in a long-term care facility in Kentucky. And, you know, very similar to the home health market, you know, and workforce, he was very tired of CNAs coming in, getting hired, and then quickly leaving. And, you know, whether they went down the street to another nursing home, or in many cases, they went to Walmart or McDonald's and got a job. And he was trying to figure out how could he impact this market. And there are a number of factors that went into it that he knew as a, you know, that he couldn't really change. But one thing he saw was brand new caregivers, folks who went through a CNA training program, you know, did the hours the state required, but had no idea what they were getting into. And he was trying to figure out, how can I give them a better sense of the real role, you know, the good, the bad, and the ugly, as our Chief Learning Officer says, to really highlight to them, you know, not just teaching them the content they need to pass the state test, but also the skills that make a great caregiver. So how can we teach compassion, empathy, problem solving, conflict resolution, and so on, and at the same time show them the role, immerse them in it, and provide them with the coping skills that will help them through the challenges. And that's where our first product, Ready CNA, was born. And we you know, over the past 5 years that we've been around, or it's very quickly, actually the end of this month is 6 years, we've been asked over and over again, can you take that to the home care space? And so we have done that. We are very new in this space. So so a lot of what I'm going to point to right now is from our CNA work, where we currently have states programs that are approved to utilize Ready CNA as part of their training in 35 states. We have another 11 states in process, but it's really using our cinematic story-based approach which I'm going to walk you through to show that. So we have, actually this number is a little outdated, just about 500 customers now across the country. And we train, over 10,000 learners a year at this point. So, our product design is really, as I already mentioned, so it's story-based learning. It's very engaging content. And I think, and that is one of the reasons that the Home Care Alliance of Massachusetts has partnered with us, because of how engaging, how it realistically depicts the role and provides that better view, which then allows for better training for caregivers. And also we have a very easy to use LMS. Just pointing to some of our clients and what they have said, 89% of our employers are satisfied with the job that Cinematic Health grads do, which is a very high percentage. And 62% of them say that those trained with Cinematic Health has helped reduce caregiver turnover, which is, of course, one of the main reasons we were founded. And we're very proud of that. So we work with a number of Massachusetts groups already. I won't read you their quotes here, but and again, this is on the CNA front. So Bain Care Management, Chelsea Jewish Life Care, Quincy College, La Brea College, Bristol Community College, and many others. But with that said, that's a quick overview. As Leslie said, please, any questions you have, you can unmute yourself and ask. I don't mind being interrupted. And certainly there's a chat, which, the team will monitor if you want to throw a question into chat, and we can kind of go from there. So with that, I have to stop the screen sharing to then screen share again to get to a different screen, if I can find it. Okay. Again, moving windows around, my apologies. So you should be seeing that I am logged in as a student. It says, welcome, Chad. And, a number of things going on here. So, this product was purposely built for the home care environment, and you'll see that in a minute. We meet all of the Massachusetts requirements with 60 hours of pre-configured video content that covers, those soft skills I already mentioned, so empathy, compassion, conflict resolution, et cetera. But then also teaching the important content that's needed, right? So, everything from vital signs to preventing injuries to assisting with activities of daily living, hand washing, infection control, and so on. And I'm going to lead you through kind of how we teach that. But first, I think it's helpful if you see who our cast of characters are. So we created, we went kind of the Hollywood route in creating our training videos. And you guys have all sat through training videos. There's a number of hours you have to do each year with your caregivers. And quite frankly, most of them aren't very good. And we knew that if this wasn't high quality, highly engaging, and very realistic, it wouldn't work. So with that said, I'm going to play you this trailer that introduces our cast of characters.
Can I get everyone together for a picture? Say, I'm certified. I'm certified.
I just got my first assignment.
In starting a new career, Carmen Castillo is opening a new door.
It's all about the breath. It's like you're ready for a workout.
She will meet new people.
What do you get when you cross oatmeal with ducks? Quacker oatmeal.
And sometimes their families.
Daddy!
Sometimes you need to pull yourself up by the bootstraps and accept reality.
She'll become part of a team.
Oh, Mr. Coleman, so you're out.
Connections will be made.
I'm your new morning aide.
Carmen, we look out for each other.
Stories will be shared.
6 years later, and I still miss him so much. And that's when I realized that there were still people who needed me.
Challenges will arise.
Oh my God, what happened?
Just remember your training and use your smarts.
This arthritis is killing me.
Here's the scoop. We're going to notify APS.
That's Adult Protective Services.
Shane Edwards, you're under arrest for...
Wait, hang on. I'm under arrest?
Something just ran behind my chair. I think it was a raccoon. Get it out before it bites my feet.
If you apply yourself, you'll get the hang of it. And the care that she provides will not only change her life, but all the lives she encounters.
Yeah, we can do that.
Because Carmen is called to care.
Mom, why are you looking at me like that?
Because I love you so much.
All right, so I think that does a nice job of introducing you to the cast of characters, but also showing you the production value behind this. You know, as I said, we wanted to make sure that we made this as high quality as possible. And so we used scriptwriters, Hollywood scriptwriters. We used the person who put this together for us has done a number of the episodes, The Blacklist on NBC. So very, very high quality. And this movie that accompanies that, and we use a case study methodology to teach with it, is a little over 4 hours of the 60 hours of content we have, broken down into small episodes that lead the student through their learning. That said, one thing to note on your end, if it seemed a little choppy or maybe the voice wasn't quite aligned with the video, that's because Zoom degrades video in order for it to work more efficiently. On my end, it was as if I were watching Netflix. So just to point that out in case it's not quite up to par, if you will. So that said, I am logged in as a student, as I already said, and this is kind of the home screen. And I've got a bunch of different things here. Your students or your HHAs, your training, would have one course, the one here that I'm highlighting. But a number of things going on here. So this learning management system that we have was designed so that it's very easy for you to enroll caregivers into the program. There are communication tools, so there's students can reach out to whomever the instructor is that you're utilizing. Administrators can reach out to students and so on. This is designed to be asynchronous. So this, students can do this at home anytime on any device. So we help you with all the setup. We help you to put a schedule together, although a schedule is not usually tied to a specific time of day. But as a guide to help students get through in the time you want to allocate. And we work, and that's why Jasmine is on this call. Jasmine works very closely with each of our partners to help them to set up an implementation model that meets their needs. And so highly customizable approach. There's also 24/7 technical support based on the fact that students could be doing this anytime, anywhere. So if a video won't load, they get locked out for a password issue or whatnot, they can always get support to help them with that. Additionally, we have progress monitoring. So you as an administrator, an owner, or an instructor are able to see where your candidates are at any given time, so that you can see, are they falling behind? Do they need a little nudge? Are they, we also have great tools that show if an individual is struggling with certain content. So do they need added support in order to get through the training? Also, all assessments are auto-graded and auto-populated gradebook to make it easier. And then we also capture seat time because, in the state of Massachusetts, or the Commonwealth, I should say, that 75-hour requirement that is there, we take care of 60 of it, and we make sure to capture that for that. So with that said, I'm going to jump into how we teach now, unless there are any questions at this point. All right, well, I'm jumping in, and the idea here is that Carmen, who you saw in the introductory video I played, is the new caregiver, and she works with 8 different clients who each has their own individual health issues, and that's how we use that case study methodology to teach what the content that a new HHA needs, but at the same time, they have their own personalities. So I'm going to use Ronald, and those personalities then, of course, reflect, how Carmen works with them and so on, and it really highlights the important soft skills as well as the giving the view of kind of the more complete view of what it's like to be a home health aide. So Carmen, as I said, works with a number of them, and I'm going to use Ronald Duchamp, so Ron here, to kind of highlight how we teach, the different activity types we have, but at the same time, how we use the movie to teach. So little background on Ronald. He is this very, very nice kind of professorial gentleman who has some serious heart conditions. And so this is Carmen's first assignment as she goes to work. And so I'm going to start with chapter 3, which I think gives a good sense of the various activity types we have. We start with a quick introduction, and then we follow that with what we call a close-up video. And I'm going to play this one on safety first. And a close-up is where you have an expert or experts speaking to the topic at hand. So this one being safety first. Let me play you some of this.
So when a caregiver arrives to the home, one of the very first things they should do is assess the environment for any safety hazards. One example of a common safety hazard that we see all the time is rugs. Rugs can become a huge safety hazard. For example, when somebody is maybe having more difficulty in ambulation, they might start shuffling their feet, or they might be a little bit more clumsy. So tripping over rugs is actually a very common injury that we see.
One thing that I also observe is in the bedroom, if there are blankets or comforters hanging off the bed, which could be a hazard for someone with a walker or a cane, they could trip over.
Wires, if they have a lamp and the lamp is plugged in and the lamp is in the middle of the room, that's a trip hazard, especially if they're on a walker or...
All right, and I'll pause it there because I think that gives you a good sense of how we put these videos together for close-up videos. But we use, and as I was saying, we use a wide variety of experts. So we have physicians, geriatricians, nurses, agency owners, clients, but most importantly, we feature caregivers because longtime caregivers, because no one knows the role better than they do. And we follow a couple of principles in learning learning design, and one of them being something called learner-centered design, or I should say learning science, one of them called learner-centered design. And the idea there is that students who see themselves in their learning are more engaged, which leads to better outcomes. And so I think we'll all agree the vast majority of our caregivers can't relate really to a physician, but they certainly can to the caregivers we're presenting here. Additionally, and I forgot to mention this as we jumped in, I'm skipping around today because I have a special account, and that allows me to skip around. But your students cannot. So their accounts are locked down. They have to do each activity to completion, which means this green check mark shows up. They can't fast forward videos, they can't skip questions, and so they have to get to that green check mark before they can move on to the next activity. And we do this for two reasons. One, they have to get that 60 hours of training in order to become licensed, and so we have to ensure that they're doing it. And we all know if we let students skip around, fast forward videos, they'd never get there. But more importantly, we design this for the adult learner. And adults, as many of you are aware, learn differently than kids. And, I've got a young daughter who I can be reasonably sure that she's sitting through her math class right now for 45 minutes, and she's absorbing the vast majority of the information that she's taught. As we get older, our brains don't work that way anymore. And what learning science has shown us is the best way to teach adults is in small bits, so small bits of information taught in context, and then to build on that over time and in complexity so the learner spirals to mastery in the subject matter. And so that's how we've done this. So we've designed this so that each of these buttons represents roughly 1 to 8 minutes of content, and then we will build on it over time. So very, very specific to the adult learner. So safety first, critical success factor for caregiving is to maintain a safe environment for the client. And this is, of course, very different than say, a long-term care facility, right? Which is much more controlled. You don't have to worry about lamp cords and other things like that were just mentioned. So very much focused on the home. And so the first episode in this chapter is entitled Distractions. And I'll play some of this for you to show you how we highlight the importance of not letting distractions get in the way.
Mommy, I'm working. I told you not to call me at work unless it's an emergency. I don't know. Did you check his room? In the hallway closet? Mommy, no sé. Just give him the black sneakers. Just tell him the black ones are the ones ninjas use. Sorry, it's not a fire.
She's just busy burning your breakfast. Make that stop. It's hurting his ears.
Queen. Sorry.
That window's broken. Turn the fan on.
All right, I'm going to stop it there. And this is as I was saying, so you can tell by the title, Distractions. This episode is designed to highlight the importance of not letting outside factors interfere with the job, right? You don't have on-site supervision, so it's really on you to make sure that you have that right balance to make sure that doesn't happen. But also, and if we went a little further into this, but in the interest of time, I'm not going to, relationships are really important. And this episode is highlighting that it's not just with the client, but with others in the home. And so the gentleman here is actually Ronald's brother, who is, quite the curmudgeon. And as you can see, he's not helping. He's also not very nice to her. But we use this, and as time goes on, you'll see as they develop a relationship, but she also is able to establish what her role is and not let him kind of dictate that it should be more than it actually is. And that of course, and I know you guys are very familiar with that, is an important element of this, of the work of a home caregiver. So we then have reflective posts. So this one is on work-life balance. So to kind of take a step back from the episode that the student just saw to see, all right, well, how would you balance your home and your work life? How can you make it successful, and so on? And there are a number of ways that this can be utilized. This can simply be a reflective post. They free write it, and it's for them to just give them that chance to take a step back. But it's also visible to instructors who can then use it for discussions. And we are actually adding a new discussion board function that would allow for an instructor, an agency owner, or whomever to lead students through discussions on this one. So from here, we get into the lion's share of instruction, which is done through in-focus videos. And I chose this one, the risk management mindset, But these are designed to really teach the content. And, I think you'll see that it's high quality and highly engaging. So let me play a little of this one for you.
Think of a place where you feel safe. What was it about the place that made it safe? Was it inviting? Did it smell good? Was it brightly lit? Were there people there who you felt comfortable around and who would look out for your best interests? Safety is a basic need for everyone. The people in your care are at great risk for accidents and falls. Safety involves being able to move in a space without fearing the possibility of accidents or other health risks. Safety also involves knowing that the people around you are looking out for your well-being. Being alert to the dangers that may threaten people in your care and your own safety is called having a risk management mindset.
All right, I'm going to pause it there, but I think that gives you a sense of how we engage the learner to teach the content that they need to be successful in the role. We then, of course, follow the concept of teach and then ask. So we feature knowledge checks throughout the program, and they function like quizzes, but they are not graded. So this one on fire safety, it's 5 questions. It should take about 5 minutes, but of the following guidelines, which one should you allow in all disasters? So you have to get the question right before you can move forward to the next question. So I got that one right. And then the next question, though, we'll get it wrong. Which of the following is not a potential fire hazard? We'll say that's not a hazard. We're told it's wrong, we're told why it's wrong, and we've got to go back and get the right answer before we can move forward. So very quick, 5 questions. These are placed throughout the program just to make sure that the learner got the basics content down before moving forward and giving them more. So from here, we move on to a chapter on communication with agency and family. We get into the care plan, reporting and recording, objective and subjective information, a chapter on housekeeping. We have a chapter on vocabulary, and then we get to the end of this section with Ronald and there's some brief test preparation to get the student, to provide some strategies, test-taking strategies, and then we get into practice tests. So, and we have a couple of practice tests here, and these tests are graded, and they go into the grade book. So that's a real quick overview. Well, actually, you know what? I'm going to jump into, I forgot, I got to show you a little bit more on Ronald. But if there are any questions at this point, while I switch over to another section, because what I didn't highlight is during, in that section, Ronald's daughter decides she's going to move home and take care of him. So Carmen's services are no longer needed. And she goes on to work with Rooster Bowman, Alice Habib, but then she's called back to work with Ronald again, because as I know you guys see, family caregiver tries to step in, whether it's to save money or it's out of, the desire to help, and they realize they really can't do it. So, or the parent or whomever has gotten sicker, and that's what happens here. So she comes back after working with another couple of clients. So she returns, there's an episode on the reunion. There's then an episode where Ron gets sicker. As he gets sicker, things start to go downhill. So as I mentioned earlier, he had heart issues. So it's his cardiovascular care where we teach how to care for that. And then we get into kind of how things progress. So let me start here with this episode, and then I'll play you the next episode, or another episode, not quite the next one.
So you're just gonna give up? Adios into the sunset? Like none of us even matter?
Howell, we could opt for extreme measures, but they would drastically decrease your brother's quality of life. We've talked it over with Ron. As soon as it's medically indicated, home hospice care will
So
be
you talked him into this. That explains it, because my brother is not a quitter.
Hospice will protect his patient rights and will provide the comfort and care that he'll need.
That is not your choice to make.
It's my choice, Howell. I don't want to go through what Mom went through. I don't want to put you through that. It's my time.
You should all be ashamed of yourselves.
It's okay.
I'd like Carmen to continue with me even after hospice arrives. Is that be okay?
We can talk about that.
So a pretty realistic scenario that really highlights kind of some of the struggles that occur as someone is getting ready to enter into hospice, and some very realistic touches on the importance of relationship between the caregiver and the client. As she was invited back into the house, now he's asking if she can remain while he moves into hospice, which, as you're well aware, doesn't often happen. But it also highlights the family dynamic, right? And I know you guys have seen this where, Ron is ready. It's his time. He recognizes it. But in this case, his brother isn't. And his brother gets mad at him for giving up, but at the same time takes that anger out on the caregivers. And so you see the conflict resolution skills they need to kind of bring to the forefront there to help. So from that episode, we then get into a chapter on hospice and palliative care. There is an episode with Ron that I'm going to skip on hospice care, but then we get to here. And I think that this is an important one to view. So let me play you most of this, and then we'll finish up our demo.
Alananita na nananita ea nanita ea. Mi niña tiene sueño, bendito sea, bendito sea. Alananita na nananita ea nanita ea. Mi niño tiene sueño. Bendito sea, bendito sea. If you put your hand on his, it might be too much pressure for him. But if you put it underneath, he'll know you're there.
I can't.
I can help.
I love you, brother. I'll see you on the other side. It's okay. You can go. Carmen. Carmen. You made a sound. Is he still breathing?
So I'm going to stop it there, but not the easiest thing to watch. But I think this does a nice job of kind of highlighting how we teach, those soft skills, empathy and compassion, and at the same time, how we better prepare the caregiver for the role. I mentioned earlier kind of the challenges, and our goal here is, not to scare the caregiver, but to let them know what to expect, and then to provide some of the coping skills. And we get into further episodes after this, where Carmen processes what has happened and gets help from gets some support from other caregivers to work through her feelings on this, and to realize that she's really making a difference. So really helping them with the coping skills that they're going to need. So terrible place to end a demonstration, but that's really what I wanted to show you guys. Would love to open it up to any questions. And Jasmine, I think you had a couple of questions you were going to throw into chat so we got a better sense of where everyone is on this.
Yeah, absolutely. So I will actually share my screen so you guys can read the questions, but I will also let you guys answer it in the chat. So just give me 1 second to pull this up.
And
here we go. So we have 2 questions for you guys. Feel free in the chat to answer it. So the first one that we'd love to find out from you: do you currently train HHAs in-house or caregivers in-house? And the second question is, what is the biggest challenge that you guys are facing? Whether that's, staffing, is it retention or turnover, time commitment to providing the caregiver training, and so on. So please feel free to answer them in the chat.
Yeah, that would be great. And then while that's being answered, I know that someone asked what the price of this is. And through for the 60 hours of content, the price per caregiver is $350, which is discounted from our rack rate, if you will, of $450. And while I know in the home care space that can be pretty expensive, although in Massachusetts, with classes typically costing around $600, and this being most of the content needed, it really is can be quite affordable. But also just the retention that we are confident this will show you will help tremendously to cut other costs. So, what other questions do you guys have? And feel free to go off mute, and because the chat's a little crowded now with the poll. It got a little messy here. Can you use, all right, so I am seeing though, Joan asked if they can set up in-service classes for continuing education. So at this point, we haven't done that. We haven't created this to provide in-service. That said, a number of our initial clients have asked that question. So I'm pretty confident we will do that. Although that said, and if and I'm not up on Massachusetts, but I believe it's 12 hours of continuing education a year. We may not have all of the content for a specific plan you would want to do, but this could be part of it. So we are working on that. Additionally, Joan, and do you set it up twice a year or are all hours completed at once? I'm not really sure what you're asking there.
Alrighty, Chad, we have some other questions.
Okay.
Another one, are these instructions and videos also in Spanish? This is from Francisco Matos.
So at this point, they are not, but I do believe we will. We are converting our CNA program to Spanish right now, and I know we will follow with HHA.
Wonderful. Oh, and I have another one from Denise Palmer. Do you have ongoing trainings as well? And can your training integrate?
Right. So I think that was the question on continuing education. Correct me if I'm wrong, but at this point, no. But our plan is to do that.
Jen Abu has asked, is this available in other languages?
So we will be adding Spanish to it. And at this point, that's probably all, to be honest. But we're always open to talking and learning and the more knowledge we have to make decisions, the better. So if you have languages other than Spanish that you're interested in, you can let us know.
Wonderful. Kimberly asked about the training cost. I know you mentioned this, but she might have not been here for that.
So yeah, so the training cost is $350 per student. It is. I did see someone asked if that was a one-time fee. It's a one-time fee per student, yes. And then they have access for a year to the program. There's also, can a caregiver sign up on their own? So they can't sign up through us because there is an in-person component, that clinical portion that needs to be provided, and we don't do that. That said, we do partner with organizations where a caregiver can sign up. Bristol Community College, as an example, will be utilizing this summer with students. And so a student can sign up through them and pay them. I'll be honest, I don't know what they are going to charge for it. But I do know some of our other Massachusetts partners charge $600. There is no minimum number of seats, and you can get a new seat every day if you want. That's the joy of online, is you don't have to, you don't have to have a cohort of 4 or 10 or whatever. As you hire them, you can put them through it. So you can have a student start tomorrow, a student start next week, and 2 students start the following week. It really does provide a lot of great flexibility.
Chad, there's a question about what other states is this meeting the requirements in? Specifically, they said Connecticut, but I know we have members that serve all of our neighbors.
Yes. So Massachusetts has the most defined requirements around HHA. We know in Connecticut, the vast majority of HHAs actually get their CNA, which is different. But then we also have other programs so we call this Ready HHA. We also have a program, Ready PCA, which is designed for a straight caregiver, not a home health aide. So it's a lesser training that, I'll be honest, because each state is different, we haven't assessed every state for that. But certainly that is a program we have, and we can talk about if you're in other states that don't require an HHA for it. So more of the straight caregiver role, if you will, companion or what have you. But more than happy to talk individually with each of you from other states.
Well, Chad, there was one question up top that we missed. Heather asked, do we integrate with other LMSs such as Relias, for example?
So we don't integrate with Relias. We can, we just haven't yet. Because they're based on how an open API, and I won't get into the technical side of things, it is possible, but there typically is added cost with that, and it's really on a case-by-case basis what that costs. It does, Jen, you're asking if it works on all devices and platforms. It does. There is no app at this point. It is web-based, but it is optimized for iPhones, Android tablets, and of course, computers. And we know, and I can also, you ask about accessibility for caregivers. We do know that, 40% of our students do our Ready CNA program on their phones. So it is, to me, that seems crazy, but I'm old. But we do know that is how they access it.
But there is one question here, I can answer it. Is there a minimum number of seats? Can we request new seats as we hire? So there is no minimum. You can literally just put in one student, or you can put in multiple students. We have some programs that will, as they hire, they'll put someone in, or they'll actually set up class dates, saying class will start on April 1st. And that's when all the students will go in, or on a rolling admissions basis, that's when you can put in a student.
And we do know, and we mentioned this a little earlier, but we do know the sooner you capture a caregiver, as a new hire, the better. So we really did make this so you could get them right into it right away.
Yep.
So what other questions do you have?
There was one on startup costs. Chad.
There are no startup costs. And Jasmine will work with you to get things started. Any documentation you need for the state, we will take care of and help you set up your schedule, everything, how you want to implement it. We have some programs that want their caregivers to come to them and sit in a classroom and do this, even if they are working independently. We have others, and the vast majority actually just have them do it at home. Because you can monitor, you can see what they're doing and so on. But Jasmine will help you with all of that. We also offer marketing support. So we can help you create social media posts, flyers, whatever to help with your recruitment of caregivers. And that is all free. All of this is just added to it. The only charge we have is on a per student basis that I already highlighted. I see Angela asked if we have Ready CNA. Yes, that is our program. So I'm assuming you're familiar with it. Elaine asked if there's infection control. Infection control is throughout the program, but yes, we have a heavy emphasis on infection control, which ironically, we had that emphasis for Ready CNA even before the pandemic. Let's see.
Chad, is there some sort of an employer dashboard that you could show people so they can track the progress of their new hires?
We do have that, although I don't have it set up right now, so I can't really show it to you. But yes, there is a dashboard where you can see every caregiver, how they're performing, where they are in the program, and so on. So let's see. Lee is asking how students get signed up. It's really as easy as, we create what would be an open key, I think, for most of you, which means there's a monthly key that Jasmine would set up for you, and then you log into the system. You enter the caregiver's email address. It then goes to the caregiver, invites the caregiver in. They set up an account based on their email. They choose a password, and they're ready to go. So it is very, very simple. Danielle's asking if Ready CNA is more than Ready HHA. It is. Ready CNA is anywhere, our rack rate on Ready CNA is $600, although in most instances we charge $450 for it. And if you happen to be a leading age Massachusetts we work closely with them on that side, on the CNA side. Let's see, is this the only for certification? Yes, it is only for certification at this point. That was one question that was asked. Hands-on skill component is on you, the training provider, the agency owner, or what have you. We only provide this online content, but that hands-on is taught and handled by you. Angela, Melissa will throw her email address into the chat, so you can get in touch with her. But it's melissa@cinematichealtheducation.com.
We got another question. I saw it a few times that says, is Ready HHA only for certification, or are organizations using it for onboarding purposes?
Yeah, I just answered that, Jasmine.
Oh, you did? I am sorry. Yes. I'm going through all the questions.
So it is for certification. Also, DPH, yes, we keep testing scores, completion data, test scores, hours for DPH. So that is all contained within the system for you. Is there bulk pricing discount for large agencies? We would have to talk about that. Typically, there isn't. To be honest, but we're always open to talking about it, Heidi. Is there a list of material covered during the training? Tracy is asking. Yes, there is, and we can provide that. We do provide that to you, so that and how it aligns to all of the state requirements. Angela, how do you sign up for the program? Melissa can help you with that, and then Jasmine. Questions on starting a service agency. I don't know, Jasmine, are you, well, go through Melissa, and Melissa will get you the right support you need, Juliet. So.
Yeah, we have a question. If we could ask by voice instead of typing, he does.
Absolutely.
Okay. We are a home care aid agency. We go to the patient's houses and we only hire CNAs at this time. They come to us already certified.
Yep.
Could this training be used for orientation training purposes?
Yes, it could be. Okay. Yeah, and we are actually one of the products we're in development of, and I hope to have it fairly soon, is what we're calling our HHA Bridge program, which is exactly for what you're describing. Someone who is a CNA, but needs some background in home health, because if you're trained as a CNA, you're not trained in a home environment, and the challenges that come with that. So we are creating that. We don't have it today, but we are creating that.
And I'm not sure if the question I posted was answered, because I was trying to unmute myself. Do you happen to have like a list of the material that is covered during the training right now?
Yes.
Like we during the training we cover Alzheimer's, cardiopulmonary, things like that. Absolutely,
Tracy. And if you get in touch with Melissa, she can provide you with a course overview and unit objectives, which covers all the subjects we touch on. And then we also, for Massachusetts right now, I don't believe we have it for Connecticut. Right, Tracy, you're in Connecticut?
Yes.
So, but for Massachusetts, we also have an alignment document that shows, exactly each requirement the state has, where our program meets that requirement.
Perfect. Thank you.
Yeah, and also to add on to that, Tracy, once you get to the point that you're ready to kind of build out your schedule, I will help you with creating a schedule that will outline for the students exactly what's going to be covered in the course, and you can intertwine the lab skills, and I'll help you through that process.
And do you know how long the training? Usually our orientation training takes about 2 weeks of the material that we have right now. If we use yours, how long does it take?
Well, ours is 60 hours, and we don't recommend that that someone sit in front of the computer for 40 hours a week. It's just too much. Yeah. But certainly, you could do it in 2 or 3 weeks for that 60 hours.
Okay, thank you.
Gertrude, you look like you were going to ask a question, but you're muted.
No, I just got into my car. Sorry.
No, that's all right. I thought you were looking down and I was like, oh, you might be talking and not realize. No worries. Glad you stuck with us while getting into the car. What other questions can we answer?
So, I mean, this is Juliet. I've been a caregiver. I've been taking care of my mom who has dementia for 15 years. And it's a tough job. And I really have not found somebody who really who can come in and do what I would ask. So I've been doing it all by myself. And so it was kind of downloaded to me at some point, maybe a month and a half ago, that I needed to look into starting an agency. So I've been working with Relias. I've been doing their trainings, for years, just because this is what I like to do, just taking care of people. So I haven't really done anything, sign up to do anything with them yet. But so this is coming timely because I had a meeting with them a couple of weeks ago and I have to go back and talk to them. But starting up an agency, would you guys be able to kind of walk me through the process, or you don't do that?
No, we don't really do that. We're focused on the workforce development aspect of this. So we are not experts in starting an agency. I don't know, Leslie, if you guys provide support for that, or
I'll send her an email. We have a little bit of materials, but we aren't really equipped for that either. So.
All right. Okay, that's fine. I mean, I'll look into it. I just wanted to ask the question.
Yeah, thank you.
Yeah, absolutely. Well, we're right up against the hour. Any last questions? Or if anyone would like Melissa to reach out, she's going to reach out to all of you, but if you'd like her to reach out quickly, just raise your hand or throw your info into chat. Gertrude raised her hand, I saw.
Do you have my contact, or do you want me to put it in the chat?
Well, more than likely we have it from your registration, I think, but if you throw it in.
Okay, great.
Yeah.
All right, thank you.
Sure.
Wonderful. All right. I'll get off now.
Thank you for attending, everyone. You'll get a link to this recording. Everyone who registered will get a link to this recording and the follow-up materials from our friends at Cinematic. Thank you for learning about this member benefit.
Yeah, well, thank you, Tim and Leslie, for having us, and wonderful. Appreciate everyone's time today.
Thank you, everyone.
Thank you.